Here on The Colour of Country Life, good to be chatting with Anne Ruston, Senator for South Australia. How are you going, Anne?
I'm very well, thanks, Ricky.
Are you enjoying just being able to get out and about a bit more in regional SA since being the Minister? And I know you've lost government, that's sad, but is there an upside?
Look, there absolutely is. One of the things that I haven't been able to do, particularly for the last 3 years through COVID and being a Cabinet Minister, was actually to spend a lot of time in rural and regional Australia. So for the last few weeks, since being made the Shadow Minister for Health and Aged Care, I've been spending my time visiting rural and regional Australia, but particularly rural and regional South Australia, to speak to people about the real challenges out on the ground. And it's really quite interesting when you get out there to realise that even though the challenges are in some ways similar, in many regards, individual communities have individual challenges. And so, it's not a one-size-fits-all fix. So I think, there's some real challenges, but if you listen to people, it's amazing what you can learn.
Yeah, we might get into those individual challenges in a moment, but just first chat we've had since the Shadow Ministry was announced, as you say, Shadow for Health and Aged Care, but also for Sport, and Manager of Opposition Business in the Senate. You've got to concern the sitting calendar for the rest of the year is a bit light on.
Well, certainly. I mean, when you consider that we haven't had a Labor government in office in Canberra for 9 years, you would think that the first thing they would do is to give the opportunity for all members of the opposition benches, not just the Liberal and National parties, but also the Greens and the rest of the crossbench, the opportunity to be able to prosecute their new policy positions, the things they put out during the election campaign and their policy platform. But instead they've chosen to make a very light-on calendar. But the thing that probably I think it should distress Australians more than anything else is that this will be the first budget that's been brought down by this new government. And normally we would have somewhere between 8 or 9 days from 9 o'clock in the morning till 11 o'clock at night to investigate and scrutinise the budget, because it is such an important thing that any government brings down. This new government's decided that they're going to give us 6 days. And I think that's just manifestly inadequate, particularly for a new government to not give us the opportunity to scrutinise their new budget.
Yeah, that's what I thought was peculiar myself, was that usually governments issue budgets in May. Your own did around about, was it April or May? But, they're bringing out this change budget in October, I suppose, a bit out of session. And yet, it's kind of a take-it-or-leave-it budget approach.
Well, the most important thing is we need to understand, it'd be time to prosecute what was in the budget that we brought down before we went to the Australian people for the election. And it was a very comprehensive budget. It was sort of the first post-COVID budget. What's going to be taken out of that budget? What are the changes? I mean, there's a lot to unpack when you change governments because they take a different approach. And to deny it sort of almost a third of the time to be able to prosecute what they're doing and scrutinise what they're doing suggests to me that transparency and accountability is not something that they're prepared to provide to the Australian public. They went to the election saying we're going to be accountable, we're going to be transparent, and their first action in a parliamentary sense is to actually restrict transparency and accountability because they're restricting scrutiny. So I think there's some questions that they need to answer, but clearly they don't want us to give us the time to ask them.
And one of our other broadcast areas in regional New South Wales, former Nationals leader Michael McCormack said often it's regional Australia that feels the brunt of it when a Labor government comes in terms of cuts in the budget.
Look, unquestionably. And I think, you've only got to look at the lack of understanding that you see in policy positions around rural, regional and particularly remote Australia. Just as an example, earlier this year, Mark Butler came out and made comment around how they wanted to change the classification of outer metropolitan areas around things like overseas trained doctors and bonded doctors program, because that's been in place to try and put an incentive for people, the overseas doctors and bonded program for doctors and GPs to go to rural and regional Australia. He wants to expand that to outer metropolitan areas. I mean, the first thing that's going to happen clearly, and this has been said by the Rural Doctors Association, is that it'll just suck those few doctors that are left in rural and regional Australia, will suck them into outer metropolitan areas. So I don't know whether it's an ignorance or whether it's a don't care, but these are the kinds of things that we've seen as policy positions that ignore the needs of rural and regional Australia. So I'm going to be calling on Mark Butler every single day, as I will with Annika Wells in aged care every single day, to make sure that issues that relate to rural, regional and remote Australia are being prosecuted, because I'm not going to let them forget that the rest of Australia actually still exists, even if they don't want to acknowledge it.
Well, I'll be the one who says it cynically. I think it's about votes in outer metros where Labor has a chance of winning seats. Shouldn't be that way when it comes to healthcare, especially for regional Australians. And Woodner is one classic example where I think they're now going to get a doctor, according to the local council, 3 days a fortnight visiting the local services. Isn't that an example of where we need to address that shortage? It's just not enough for a local community.
Well, certainly local communities are really, they've been feeling the pain for some time. And I think, we tried very hard while we were in government to put incentives in place. But to be able to train Australian-trained doctors obviously takes time. We were restricted during COVID, particularly about overseas doctors being able to come into Australia because our borders were closed. There was a lack of workforce that we were able to access from overseas. And we know that a lot of our care workers come from overseas. So there were a lot of things that I think have exacerbated the problems in rural and regional Australia. But one of the things that I've always believed, coming from a regional community myself, I was on the Renmark Hospital Advisory Council before I went into Parliament, has been the need for the continued investment in our regional hospitals, because the lifeblood of any community and the ability to attract health professionals into a community is the existence of the hospital and the services that are provided at that hospital. And you mentioned Woodner. I was actually in Cummins and caught up with the GP in Cummins last weekend, and we were talking about how the sort of operation of the South Australian health bureaucracy, and it's been going on for a very long time, back in my time on the Renmark Hack, has been to centralise the services in rural and regional areas. So these local hospitals that are so important in local communities are having services taken away. And in the case of Cummins, they no longer can get a rebate for their X-ray machine, and the South Australian health bureaucracy won't provide them with one that is new enough to be able to access that rebate. These are the kinds of actions that I think we need to be prosecuting with both the state health department, particularly, but also making sure that the feds are held to account, so that the local hospitals have got the services that mean that the rural specialist GPs have got the kind of access to their development that they need. And the reason why they're rural generalists is because they have got a hospital that allows them to deliver babies, to be able to do minor surgeries, to have accident and emergency, all of these things that I think are really important in local communities.
Are there any looming threats on that continued obstetric services in regional SA? I've just picked up something I haven't been able to investigate yet, but there was a suggestion that maybe the insurance arrangements are going to make it harder going forward for that to keep happening.
Well, I think one of the things, this goes back to that whole making sure that our rural and regional hospitals are fully serviced and have got access, and are able to perform all of the processes and services that enable them to be able to do this. And I think, I was in Tasmania this week, and, like, for instance, King Island, they've got a perfectly good hospital, but they're not allowed women are not allowed to give birth on King Island. So for 4 weeks before they are due to have their baby, they have to fly to Burnie or Devonport, often leaving home, a couple of young children with no mum for 4 weeks or so, to go and have their baby on the mainland, when if we provided these services in place, and, of course, whenever there's complications with a birth, you want to make sure it's somewhere where there are much more specialised services. But in many instances, particularly on second, third and possibly other subsequent children, childbirth can be quite a simple exercise, but they're not allowed to give birth in some of these rural and regional hospitals. And I think we need to have a look at, what the community wants. Maybe ask the mother what she wants. So I think there's a lot of things that we can do to actually have a look at how rural and regional communities want their health services delivered, and then look at ways to make sure that we deliver what they want.
Well, just lastly, Prime Minister Albanese has talked about, I think it was National Cabinet he pulled together and talked about a new sort of funding deal between states and the federal government regarding hospitals. Do you see regional hospitals getting a slice of that pie if somehow the federal government finds a way to get more money down to the states to deliver health services?
Well, I mean, the first thing we need to know from the Prime Minister is actually what does he mean. There's been calls from the state and territory premiers for a change in the funding model from what it is at the moment to what they refer to as the 50-50 funding model. But, we need to understand what that is. We need to understand what that's going to cost, because the federal government over the last 9 years has more than doubled the amount of funding that has gone to states and territories to support their hospital systems. Now, in many states and territories, we have seen a much, much less increase in investment from those states and territories into their own hospital systems. And so my question to Mr Albanese is, is he just going to put his hand in the federal till and provide more money to states and territories unconditionally? Is he prepared to stand up to them and say, no, you actually need to continue to invest the same way the Commonwealth has been investing, increasing the money into hospitals? But absolutely, if there is to be a change in any hospital funding, we will be, as a coalition, demanding that rural and regional Australia gets their fair share of any increases in funding that goes into the hospital system. But I think the primary question here is, what is the Prime Minister going to do? How much is it going to cost? And what are the states and territory premiers going to do about making sure that they're investing in their own hospital systems? Because at the end of the day, the responsibility for the operation of hospitals sits with the states and territories, not with the Commonwealth. We just provide a significant amount of funding to support them in doing that.
Well, South Australian Senator and Shadow Minister for Ageing, Health and Sport, Anne Ruston, thanks for joining us today on Flow.
Thanks, Ricky. Thanks for having me.